going to grow. So there's a special fund, community fund that has been created that Human Services and the Princeton Children Funds and SHUP, they're collaborating on. This fund would provide assistance to members who have essential expenses that are due to job loss. And so we just want to announce that for those who need assistance and also those who wish to donate, to please contact Human Services. And also it's listed on the Princeton COVID website. Also wanted to mention, I have some related to Board of Health, but I'm sure that our health officer will talk about that in detail. If there's anything that's not reported on, I may want to add to it on my part. But regarding public safety, we have heard concerns from many members of our community that there's some observed residents that may not be following recommended guidelines regarding social distancing, and are still gathering in groups. Also, we've heard comments that and concerns that there were many residents in our community who were receiving some false alarms regarding National Guard coming in, and it's not true. So we decided with collaboration with public safety, Mayor Lempert, and we have we've actually reached out to others in the community to assist in creating some short videos in Spanish. Right now it's in Spanish and Mandarin that serve as public service announcements, and they're published on the municipality's social media and also on the Princeton COVID website. Like I said, right now it's on Spanish and Mandarin, but if anybody identifies other languages, that we should also perhaps consider finding someone to translate them into another language, we'll work on that.
Great, thank you for that. Next, Councilman Williamson.
No announcements. I have some things, but I'll wait for the reports section.
Okay. Councilwoman Niedergang?
Similar to Councilman Williamson, I have a few things to add, but I'll wait until reports.
Okay. Ms. Perham-Lambros?
Yeah, I wanted to mention that there's a Zoom conference call for the business community that's every Thursday at 10 a.m. And if you're a business, whether you're a Princeton Merchants Association member or not, it's open to all businesses. And if you're not on that email list, you can get on the email by going to our website or the PrincetonCovid.org website and signing up for the mailing list. And by the way, you can also, if you're not getting our weekly newsletters and daily updates from the Mayor and Council, you can also sign up there. So thank you.
Great, thank you. And Councilwoman Sachs?
Just reiterating what Councilwoman Perham-Lambros said, which is that we're encouraging all residents to sign up for the daily newsletter, and that can be found on the Princeton COVID website. And we're really working hard to release timely information on a daily basis. And the more people who sign up, the better we can do our job of keeping you informed.
Great, thank you. You know, the last time we had a council meeting, it was before our community was, you know, had been hit with the stay-at-home order and was really grappling in a deep way with the COVID response. So I did just want to take a minute and thank Jeff Grosser, the Princeton Board of Health, for we are so well served, and I wake up every morning and go to bed every night just feeling so lucky that we're in a place like Princeton with so many just really smart, capable people who are on top of it locally. So thank you for all of your work and for putting in just unbelievable hours and for doing all that you're doing. And I also want to thank our first responder team, especially Chief Setter, who's been running the emergency management team. And again, it's, you know, these folks are out there every day and they're the front line for us. And we really thank you for all the work that you're doing and for what you're doing to keep the community safe. I also want to thank Princeton University. I forgot to do that at the top of the meeting. They gave us a lot of technical advice, which is letting us come to you tonight, hopefully successfully. So we're very appreciative of their help with that and being a really great partner through this crisis. I wanted to reiterate Councilwoman Perrin-Lambros's plug for signing up for it used to be a weekly newsletter, now it's a daily newsletter, and you can go to princetoncovid.org. And I also wanted to put in a plug for that website and thank the library for really stepping up and helping to put that together very quickly. And every day when you go on, there's new resources there. So whether it's you're looking for just health information, where the open testing centers are, what to do if you feel sick, what to do, just to, you know, it's spring break now for the kids. So if you're looking for edifying activities that they can do in front of the screen, there's really great curated lists there by the library. If you're a business, there's information for you there too. So princetoncovid.org. And we're hoping that it will continue to grow and be a really important community resource through this crisis. And my final announcement is that the waiting room at the Dinky has been shut. And this is in response to a New Jersey transit policy where they're shutting down all of their waiting rooms. So the train is still running, but the inside of the waiting room has been shut in an effort to make sure that people are maintaining social distance, and it's probably an area where it's hard to keep it constantly clean and uninfected. So if you see a sign there, that's the reason why. And with that, are there any staff announcements? I can't see you, so if anybody has a staff announcement, if you can raise your virtual hand. All right, I'm not seeing anybody, so we will move on. We had an award of recognition on the agenda for tonight. And for those of you who've been at prior meetings, this is an opportunity to recognize an individual or a group that's really gone above and beyond in serving the Princeton community. Because of the format tonight, it was going to be hard to properly honor the designated recipient. So we're going to put that on hold and bring this group back when we can actually hand out their awards in person. So one of the many things to look forward to when we start returning back to normal. And with that, we're now going to move on to our presentation for this evening. And we do have Kristen Applegate with us here tonight with a construction update. And just to let people know, this is not something that council is going to be voting on, but we found it helpful during the university's Arts in Transit construction project to have Kristen come in periodically to give a report to council, just so that we're aware of what we might be seeing on the streets that might be impacting residents, or we might be fielding questions from residents, and also just to let the community know about what to expect. So with that, we've invited Kristen to come and brief us on what we're going to be seeing over the next few weeks with some of the construction going on at the university. And before I turn it over to her, I also want to thank the university for a very generous donation they made to send hunger packing. And this was money that the university found quickly to support making sure that we are getting food to vulnerable families. and we're very appreciative of that. And it's been a really great partnership. So thank you.
Well, thanks for mentioning that, Mayor and Mayor and Council. Thank you for inviting me to be with you this evening. It certainly seems like a lifetime ago when Liz and I discussed setting up this presentation. If you can indulge me for one moment, would like to just make one other brief announcement. Starting tomorrow, you'll see information on the university's website. The university will be hosting community blood drives for the American Red Cross. We'll be having 5 dates when anyone from the community can come to campus and donate blood. Of course, there's a severe shortage and crisis with blood donation right now. Information will be up on the university website, but we're holding dates starting next week, April 16th and 17th. So would encourage those that are able and interested to check into the availability of a space. And if you're interested, you can always check with the Community and Regional Affairs Office at the university. As the mayor had mentioned, these were, when we were underway with the Arts and Transit project at the university several years ago, we found it very convenient and helpful to come forward on a regular yet irregular basis to provide updates on construction. So Mayor, thank you for inviting us to start on the process of doing that again, and hopefully I'll be able to come and meet with you perhaps quarterly to give you updates on construction. So I will now attempt to share my screen because I have a very short set of slides to share with you tonight. I know you have a full agenda, but I have, and can you see that now?
Yes.
Okay, great.
Yep, looks good.
That's great. I guess I was a little bit of the test case here for seeing how this technology works. So fantastic. So there are just 2 projects that I wanted to update you on this evening. A project that's been underway now for several weeks is embedded within the campus. It's actually the construction of 2 new residential colleges. You'll note at the lower left-hand side of your screen in the shaded area, that's where the project is located. So you can tell that it's along what is known as Elm Drive, which is an internal campus road. Demolition of the athletic facilities, which had been on that site previously, has been completed, and excavation on the site has actually been underway for several weeks. Our goal is to have this project completed and occupied by students in the fall of 2022. So we know many people are walking and biking on campus now that there's a little bit more free time and doing it at socially distanced ways. So if you see the construction in that area, I wanted to mention it tonight because that project is underway. The second project that I wanted to mention, because of course this one is more visible, it's actually something that I'm quite excited about. So the university has received approval from the planning office to the center right side of the map along Fitz-Randolph Road. You'll see 2 small areas that have been noted. Sometime within the next 2 weeks, the university and our contractors will be starting surface drilling. This is the initial phases of doing the geo-exchange boring that is going to help us move to a more sustainable heating and cooling source for the university, which is of course a key component of the university meeting our ambitious goals of being carbon neutral by 2046. So of course this drilling will be visible, again, starting within the next 2 weeks along Fitz-Randolph Road. But it is the first phase of what will be a number of phases across the campus in the coming years of drilling these geo-exchange bores to enable us to move to this new heating system. And a second phase of this project is in the area that I'm now showing you, again along Fitz-Randolph Field, along within a practice field area and on the area of what is currently parking lot 21 near Faculty Road. This second phase is part of an application that we will be submitting to the planning office for administrative review. And this phase of the project involves excavation prior to the boring of the geo-exchange wells. What we will do here is go down about 8 feet and then drill the bores from that elevation, what this will enable us to do is actually to achieve a second goal, which is to install new stormwater management systems on top of the geo-exchange wells, which will then be under what we plan in the future to be a new parking garage and a new soccer stadium. So we're really looking here to achieve two important goals. One, to move us to a more sustainable energy source, the geo-exchange system, and second, to be able to enable us to install significant stormwater management systems. We plan to be, as I said, putting in this application sometime within the next week or so, and having the opportunity tonight to speak with you. I wanted to mention this to see if anyone has any questions about that project, because it will require excavation of those two sites prior to the drilling of the wells. And that
Okay.
is my short presentation.
Thanks, Kristen. And just before we take questions from council on this, if there are any, I want to just alert the public who is tuning in right now that the next item on the agenda is going to be public comment. And so if you have a public comment, I just want to remind folks how this works. You should use the Q&A function on the bottom of your screen if you're watching from a computer. If you've dialed in with a telephone, then you need to send an email to princetoncomment@gmail.com. And when we get to public comment, we'll be reading through all the submissions we've received, as long as they meet the standards we talked about. So I talked about it at the head of the meeting. So, you know, not constituting hate speech or any of the other things where we'd be prohibited, or we wouldn't be reading it out loud. So with that, I'm going to open it up for members of council. If there's anybody who has any questions for Kristen, or any comments on this project. And if you can, I can't see everybody now, so if you can raise your virtual hand, I can call on anybody who has, if there's any questions. All right, I'll start. And if you could just talk about what noise people should expect from the drilling.
Yeah, actually, we've done this sort of drilling numerous times in the past. So there are actually geo-exchange as part of the construction of our Lawrence apartments, part of the construction of the Lakeside apartments, and actually part of the construction of the Lewis Center for the Arts. So the excavation per se is something that we do across the campus on a regular basis. As I mentioned, the excavation has already taken place underneath where the residential colleges will go. Doing the excavation and then having the geo-exchange bores done essentially 8 feet below the surface will actually help to buffer the noise of the geo-exchange drilling. So, you know, the noise from the excavation, the noisiest part of excavation is when the material is offloaded, and the material will be offloaded in a community other than Princeton. So this is, the noise will be somewhere, you know, like a lawnmower sort of noise. The geo-exchange drilling is a little bit noisier, but the benefit of doing the excavation and going down 8 feet, again, is that the drilling will be below grade.
Ms. Niedergang, are you raising your hand? You're muted, so you have to unmute.
I was not raising my hand. I was trying to see the rest of the panelists unsuccessfully.
Okay, I have another question. If I don't see any virtual hands at the moment, are there going to be any changes to the observatory building through this?
Actually, we are planning to remove the observatory building, but we have a separate set of materials that we'll be submitting to the planning office. So pending a receipt of that material and a decision by the planning office, the geo-exchange, the excavation and the drilling can happen around that site as that you know, discussion with Mr. Laplace is taking place.
Okay. Are there any other questions from council? All right, I'm not seeing any. So thank you very much. This is, it's always really helpful when you come and let us know what's coming,
Well,
what's going to be happening.
And thank you, and we'll continue to do this on a regular basis, and to the extent that there's something that is emerging that a council member or you, Mayor, are interested in, I can certainly come at any time. And would just like to thank you all for the excellent job that you're doing right now to serve the community in what is an unprecedented time. And would like to just take a moment, since I can see Mr. Grosser on my screen, to say thank you for all that he's done. It's been a tremendous collaboration between the university and the town to move forward in a coordinated way, and he's been a big part of making that happen. So thank you.
Great. And one last question came in while we were talking. So
Good.
can you just remind everybody how many spaces are going to be in the garage that's going in?
The space we're planning for, and I think the exact number is 1,570 spaces, 1,570. The intent of this, and thanks for asking that question, as we move through additional projects, there's of course a plan to build new facilities for the School of Engineering and Applied Sciences along what are now the parking lots on Ivy Lane Western Way. Those parking lots will be removed. So the capacity of the garage is intended to take the spaces that are being removed from Lot 21, the spaces that will be removed from along Ivy Lane Western Way. It's about 300 total additional spaces in addition to what we have there now, once the spaces are removed for the construction that is planned. We have a application that will go in and a very complete traffic study that will be part of that will be available to anyone from the public who is interested in seeing what the impacts are of the new parking garage.
Okay, and then now I see that Council President Cohen's raising his hand. So David, did you have a question? David? I think you have to unmute yourself.
Thanks.
There we go.
Wanted to see if Kristen, and thank you for the presentation. Any thoughts about whether moving ahead with the work that you're doing right now might be problematic if the planning process is held up longer than we hope it will be by the lack of planning board meetings? That we're not exactly sure when we're going to be able to go through those. And I'm just curious if you're going to reach a time where you've got the work half done and then are being held up and it's problematic.
Well, thanks for asking that question. And actually, I forgot to make a point within this. Doing this excavation work right now, and that's why we're submitting the administrative waiver. As you can imagine, the parking demand on our campus has diminished to near zero levels. So we can start this process, this excavation process now in what is Lot 21, and do so at a time when the parking demand is not there and needing those spaces. So we actually, by beginning the excavation process, can help to reduce the overall displacement of parking, the duration of that, and shorten that if we can start on that one section. Of course, as you mentioned, we will need to go through a full planning board process, and we anticipate that with the parking garage and the soccer stadium. We will be submitting the applications, and we know that we will be waiting along with others, but we think that there's a critical moment here where we can start this work and actually over time reduce the overall impact to parking. Of course, our goal is always to avoid having cars moving through neighborhoods and parking on public streets. So that's our end goal.
And I'll just offer as a quick follow-up, since I know, Kristen, you said you were going to log off after you finished your presentation, so you won't hear my report from the IT committee, but we've been working actively on researching the opportunities for electronic submission of land use applications and building permit applications. And there seem to be some opportunities there. We still have to work out the details, but hoping that we'll be able to at least get the submittal and review process going, so that then when the planning board meetings are able to occur, we won't have such a backlog.
Thank you. And I don't think there's any more questions. So I want to thank again, Kristen, for coming tonight and for bearing with us and for showing us that you can indeed share your screen.
Thank you.
So we appreciate that.
And knowing that we're doing this in a new way, I'll work with Dolores to make sure that this presentation material is available after this meeting in a publicly accessible way, so that anyone that didn't see it tonight or had some technical difficulties at home can be sure to be able to see it.
Fantastic. Thank you very much.
Thank you.
Thanks. Bye.
Bye.
Okay. So now we're going to move on to public comment for items that are not already on the agenda. And the way we're doing this again tonight is if you have a comment or question for something that's not already on the agenda, we're asking that you type that into the Q&A box that you'll find at the bottom of your screen if you're viewing this on a computer or on a mobile device. If you are dialing in with a phone to this meeting, then you should email your questions or comments to princetoncomment@gmail.com. And I will, is Dan
Mayor?
monitoring the Q&A? Have we
Mayor?
yet any?
If I may?
Yes. Yep.
What we'll do is there are two comments that have been already addressed by you. So we're just going to ask Dan to actually read the one comment on the screen.
Okay.
Okay, so there's a comment from Mike Pizarro, who's the policy director for the Watershed Institute. He stated, as many of you know, we closed on 394 Ridgeview Road property last Friday. This property was where development was proposed that would have degraded wetlands and one of the headwaters of a mountain brook tributary. Because of the support of Princeton, the council members and mayor, the Watershed Institute, along with the Friends of Princeton Open Space and the Ridgeview Conservancy, were able to protect it. I thank you for you and that support.
Okay. Thank you for that. And are there any more public comments? Do we know if there's any that came in over the email?
I have no comments over email, Mayor.
Okay. All right, then I'm going to close the public comment and we'll move on to reports. Jeff, I'd heard that you were having internet problems, but it looks like you're with us.
Yeah, don't let anybody tell you that homeschooling is easy, because it takes a hard toll on your internet, apparently.
Okay.
Sorry about that.
No, that's okay. So our first report tonight is with Jeff Grosser, who's assistant administrator and more importantly, over these past few weeks, our health officer, and Dr. George D. Fernando, who's the chair of our Board of Health. And I want to again just thank Jeff and George for their just tremendous leadership over over the past month in helping to prepare our community, make sure that we have good information that we're putting out to the public and are making smart decisions as we go along. So with that, I know I don't even know how you're going to update us, because it feels like every minute things change, and you don't have to give us the day by day since we last met. But if you can just use this opportunity to brief council on especially what we should expect coming up, and things that you may need from the council to make sure we want to make sure that you have the resources that you need.
Sure. So, Mayor, thank you first. Thank you so much for giving us the time this evening to allow me to update you on our current state of Princeton's battle against the coronavirus pandemic. as well as to the opportunity to update Princeton residents firsthand. This evening, I'm going to speak about where Princeton currently is in the pandemic, and through speaking about that, I'll discuss the work that has been performed so far from an operational perspective, and then I'll look at some items on the horizon that we'll also need to be addressing. And then I'll pass the floor over to Dr. George DeFernando, who will be discussing the pandemic from a more worldly perspective and how Princeton will fit into that. So just for some perspective, just 4 weeks ago, on March 9th, Dr. DeFernando and I discussed the steps the municipality was taking in response to coronavirus. At that time, there was 105,000 cases of coronavirus confirmed in the world, and only 647 of those in the United States. Today, there's over 1.3 million cases worldwide, 351,000 in the United States, 740 alone in Mercer County, and 41 here in Princeton. We've quickly gone from a regionalized epidemic to a worldwide pandemic. And through those grand slam numbers, it may seem difficult to make a difference locally. I want everyone to rest assured that every day we've been operating in Princeton, we're acting as if we can end that pandemic here right in town. So what has the health department been doing? We've been working diligently to keep up with the quickly changing Centers for Disease Control guidance and New Jersey Department of Health regulatory guidance. I can guarantee you that the changes and modifications coming from those entities is happening at a pace never before witnessed in public health. Much of this has to do with learning about the new virus, and the other part has to do with unprecedented social circumstances resulting from our ability to try to limit the spread. I do have to make a couple other separate points made here. I do consider the advice from Mayor and Council, the Princeton Board of Health and Administration, and specifically our police chief, who's also our OEM coordinator right now. I consider that guidance very close to what I should follow to make sure we can protect the community to the best of our ability. That guidance is being provided by the elected officials and some others. It's brought to our attention some things that are happening locally in the public. And this type of guidance looks at things that you're all seeing in the community, various retail sales practices to protect both the employees and the public, and then things that you're seeing and hearing from your fellow neighbors. As Dr. DeFernando said this before, our office went from a containment phase back in early March, and we are officially and have been in the mitigation phase, working to identify vulnerabilities in the community and trying to eliminate them, or at the very least, work to have the virus skip or bypass a particular group. A lot of people talk about, well, this has been unprecedented. It has been, but we've actually been employing many strategies from the CDC's guidance that looks at community mitigation guidelines to prevent pandemic influenza. And although this is an influenza, the document was crafted in response to the 2009 H1N1 pandemic response, and it lays out a lot of non-pharmaceutical interventions that communities can take to try to limit the spread of the pandemic. So our efforts locally, I'll try to list these out chronologically, as the mayor mentioned. I know I've been updating a lot of you on here, but there's many that haven't been updated, so I'll try to give you the main pieces of it. So the Princeton Health Department's been working in conjunction with the Princeton Office of Emergency Management, which was established a main working group, along with other subsets of that group, to work on specific issues arising from the pandemic. The first group is led by a core OEM personnel. Second group focuses on first responders, and another group focuses on social services. Each group's actions get discussed at a morning briefing, which occurs every day of the week. As you're all aware, we work closely with the Princeton Schools and the Mercer County Board of Education on the difficult decisions to try to determine whether or not schools should be kept open or closed through the first cases reported in our area. It seems like that was about a year ago, but in reality, that was only about 2.5, 3 weeks ago. It's amazing how much has changed since then. We also need to look at the March 13th date, and that was the date that the Office of the Mayor and Princeton OEM declared a state of emergency in Princeton due to the coronavirus spread in our town. And we need to make no exception on this date. This is quick action by the mayor and great leadership, because at this point, although the spread was not technically here, we were aware that it was coming quickly. And each day that we waited to prolong that actually put us in a really, really good spot with regards to our future actions coming from that. On March 18th, a dedicated municipal website was created, www.princetoncovid.org, which is in collaboration with the Princeton Public Library and the Princeton School District. It's been a one-stop shop for all information of the town's ongoing response against the virus. It's also allowed us from an operational standpoint to be able to work with other leaders in the community to make sure that things are being put out as quickly as it could be digested. And then the month of March. So the month of March, for pretty much its entirety, the Princeton Health Department's been working tirelessly, interviewing positive COVID-19 cases in our town and any known contacts. Each week of March leading up to this past weekend, our office has been spending the majority of our time interviewing confirmed cases, going through exposure points or potential exposure points, which could be household contacts or beyond, and then interviewing those individuals. This task is called contact tracing, and it's been made substantially easier through the governor's executive order, since a large part of the exposures that we typically deal with could be either workplace or even travel history, or even simple things like, did you go to the gym recently? Since all those things have been taken off of the page, it's been pretty much very, very much just household contacts. So the last 2 weeks of that has been a little bit easier. But unfortunately, last week, Princeton did suffer its first loss of a resident due to COVID-19. And our prayers and our thoughts are with that family and friends of that resident. And as a health officer, this is something I really can't explain to anybody in terms of the way it makes you feel. Obviously, from a professional standpoint, you really feel like you let down the community in which you serve. But from a personal standpoint too, I see it as something that I could have had something to do with. I wish I could have helped more. This has been hitting home more so recently than ever. And what I want people to know is, what we've been doing as a community has been something that I've never been more proud of anything in my life. Much of it's based with these non-pharmaceutical interventions, the simple things, staying home when you're sick, covering coughs and sneezes, and washing your hands often. I always appreciate when a resident sends me an email and says that they saw a retail food worker, or not a retail food worker, but maybe a grocery store worker that seemed to be under the weather. It makes me feel good that people are looking out for one another, and they're not calling anybody out. They just want to make sure that that person doesn't get anybody else sick. And I appreciate that from a public health capacity big time. So I'll wrap up pretty quickly because I know George probably wants to get on the horn here, but our mission through this pandemic, as we mentioned on March 9th, has been to protect the entire community. But I think it's important to note that we need to continue to focus on our most vulnerable population. And at first, that vulnerable population included those individuals at higher risk of severe illness, those with underlying health conditions, those with weakened immune systems, and older adults. But an important point that we need to make here, and like most things, Princeton will probably take it first, and we haven't heard it much mentioned in the media, is there's another vulnerable population. And this is starting to take form here in Princeton. And those are our workers and residents in town that have to work through this pandemic because their lives depend on it. So it could be our retail food workers, our grocery store cashiers, our landscaping staffs, our construction workers. And our future issues that we see at the health department and what we're seeing happening is this slowdown of new cases. And it's starting to show signs developing based upon percentages and total number of cases we're seeing. There is, if you stretch that graph out far enough, you are starting to see that. And I'm not the first one to say it. But with that slowdown, we have to really be vigilant, with that vulnerable population I just mentioned. And from what we've been hearing from some of our close colleagues in the acute care industry, that population is starting to be seen more frequently in the emergency departments. We have to make sure we're not taking our foot off the pedal, so to speak, with regards to social distancing efforts. And now the need for individuals to continue donning face masks of some kind. And really quickly regarding wearing face masks, I know it was something that was just brought up by the CDC on Friday. One of the reasons behind that is because we're finding out that nearly a quarter of individuals with COVID-19 are not showing symptoms. So that means that somebody that most likely won't know they have it could possibly be going out for groceries or going to the hardware store. And we're not saying that a cloth mask is going to eliminate that risk of exposure to others, but it certainly could decrease it. And as I mentioned, with non-pharmaceutical interventions, we're not looking for the perfect solution. We're just looking for a little help with regards to lowering the number of cases. We also need to make sure we continue to work with long-term care facilities. Some of our neighboring partners and communities are not doing so well with regards to long-term care facilities. And we're seeing the drastic effect that coronavirus can have if it gets into close living arrangements. Our work at the health department is not even close to being done with this pandemic. I believe we're getting there. I'm proud of what Princeton has achieved so far in terms of slowing the spread, and as we called it, and continue to call it flattening the curve, although I'm calling it bulldozing the curve. We're trying to knock this thing out. I know I've probably said enough for now, and if there's questions, I'm happy to take them. I'll now turn the floor over to Dr. DeFernando for a higher level review of what's happening in Princeton.
Thank you, Jeff. And I think I'll start by making a comment. I've worked with a lot of health officers over the years. Jeff has outstanding technical skills. He has an ability to absorb a lot of new information, but I think his ability to keep an open mind when this new information floods him and his staff, I think has been especially evident during this period. I'll give you an example. Just on Thursday, 20 CDC guidances were updated in one day. And part of my job, I have the luxury of attempting, I have some time to analyze these and potentially boil them down. But Jeff is busy, Jeff and his staff are busy sprinting, and yet they still have to have an open mind as this flood of information flows by them. So I'm sure everybody else has seen this in Jeff and his staff, and I just wanted to compliment that off the bat. I think I can best serve the council by giving some perspective as to what's going on in our region and what this is going to look like, at least in an imperfect crystal ball for the rest of the year for us here in Princeton, rather than talking about what it's going to look like around the rest of the planet. The 4 WHO categories that to me don't oversimplify it, they actually explain it pretty well, is a situation where there's no cases in a community, there are sporadic cases in a community, there are clusters of cases in the community, and then there's community-wide spread. We have been fortunate here in Princeton, while we may feel like we've had community-wide spread here in Princeton and in Mercer County, that 4th one is at a relatively low level, not like Brooklyn or Queens or Bergen County or Essex County. And so our main exposures, or our main results of Jeff's and his staff's diligent work have been to identify the individual cases that occur and make a link to another case. And then we've had at least one that we know of that I'm sure many people are aware of, the early residential party that led to a cluster of cases. So if you want to think about the rest of the year, our job is to maintain the lack of community-wide spread in our community, to prevent any clusters, and then as individual cases come up, to really track those cases down. And right now, Jeff's staff has to, can't go every last mile and can't go to the secondary contacts, as they're called. He goes to the closest contacts of that individual who may be infected and works with them. But as the year goes on, if we're given the luxury and the blessing of being able to control this more, I personally don't see it as being eradicated this year, but rather the attempt to, again, community spread going to cluster spread going to individual spread, and then maybe having some periods of time where we have no cases at all in town. But I wouldn't predict that last one in my crystal ball in any time soon. What that means for the council and for the mayor and for the health department, at least in this projection, is that Jeff and his staff, with the support of the rest of the Mark Daschle and the rest of the municipal employees will be working on this almost certainly for the rest of the year. And for the community, those members listening, some form of behavior modification, or at minimum, keeping a close ear to what's going on in the community, because Jeff and his staff and the mayor may have to modify their messages as the anticipation of things loosening up. It's conceivable, as we're seeing in some other places around the globe, that this will be something of a roller coaster. It won't necessarily be so that curve that Jeff is talking about bulldozing, it may have a disturbing penchant for having some unfortunate bumps in the road that wind up us having to mobilize again. And so that might be the biggest long-term message. In the shorter term message, many of you, if not all of you, listened to the updates from Commissioner Persicelli and Governor Murphy. They're talking about some hopeful signs in terms of infections slowing, but based on my information that I just got, we have to make sure that we remember and the community remembers that infections slowing down, which is really an imperfect measure, the impact of that slowing down on healthcare and hospital utilization is 2 to 3 weeks out. So what the estimates of the Department of Health and Senior Services are is that the healthcare surge is still a week, 2 weeks, even 3 weeks away. And what that means for our municipality is that the healthcare systems, and especially the hospitals that serve us, are going to really be inundated for the rest of this month, and probably for a certain period in the month of May. And that is part of the motivation for all of us talking, some of the questions that were asked earlier, questions about people wearing masks and when do they wear masks, and do they wear them in these circumstances. Part of this is to keep us healthy so we don't go and burden the system any more than it already is. It's maybe not as selfish or not as inward looking, but it's another type of service to the community. If we can keep ourselves healthy mentally and physically, that will be less of a burden on a system that we know is being swamped and about to be swamped even more. There's, if we can look at what's going on in New York City, New York State, and I believe is also occurring in New Jersey, many of the critically ill patients from the rest of the state, those patients will find a bed somewhere in an intensive care unit, in a critical care unit. They may find that near us, and we're not going to begrudge those people being moved to the facilities near us, but it means that even if we're fortunate enough to maintain the current circumstance we're in with sporadic cases, the system's still going to be overwhelmed near us. And that's part of being a member, being part of a community. And I've said this already, but I'll say it again. That's another big reason to protect yourself, not just to keep yourself happy, healthy, your relatives healthy, but that's a big intervention to decrease the burden on the system that we know is being swamped at the current moment. I spend a reasonable amount of time and Jeff and I have talked a lot, and I've talked to Mayor Lempert as well as the emergency management staff in the morning. There are reports on these populations that Jeff is talking about, the landscaping population, the food service populations, the various workers that are another type of first line worker. I've heard it said actually that healthcare workers are the last line of defense and the population is the first line of defense. So that part where I'm talking about the population staying healthy, that's the first line of defense. the vulnerable population, what that we're seeing around central New Jersey and into New Brunswick, and certainly around the rest of northern New Jersey, are the healthcare worker, are the food service workers, the landscapers, the other types of workers that have to be out there. And this is going to be a focus in the coming days to try to, in a understanding way, but a firm way, get some protection for those workers. That will include talking to workers who feel that they're expressing their personal rights to not wear protections, and then other workers who feel justifiably so that raising their hand and talking to their employers to get personal protection may jeopardize their livelihood. So coming at it from two different directions, that is, workers who feel like they're expressing their rights of decision-making, and then workers who feel like that if they get the protections that they so desperately need, will put their livelihood in jeopardy. We're going to have to square those circles in the coming days and get everybody protected, and convince the people who are not protected. Now, I will say I do a bunch of field work. I put a nice mask on to do this field work, and I can tell you that some of the grocery stores, for example, and other food service places nearby, some of them have, when you walk into them, every worker has a type of mask or facial covering on. Other places I walk into, all the cashiers have facial coverings on them, but some of the other food service workers do not. And then in third places, there's a choice both with the checkout people as well as the other food service workers. And so a goal that I think we need to have as a council and a community is to figure out a way to talk to our various food service providers and convince everybody involved that they are part of the community, and that Friday's community masking recommendation applies to everybody at their work site. Those of you who've worked with me before, I can be overly heavy-handed. If it was up to me, I would suggest to the businesses that they don't let customers in that aren't masked. I'm not sure we're going to be able to go that far. I'm not sure that's part of the emergency order. But in my dream, because at all these sites that I went to yesterday, while some of them had every worker covered, the majority of them had at best 50% of the civilians covered. And so those civilians need to think of protecting the people that are working at that work site. They should think of protecting themselves, I agree, but if they're going to utilize the service, they should think of protecting the people that are at that service who probably make a lot less money than the median income in our town. And so maybe I don't want to be too, I'm being very parental here, but that really wore me out yesterday doing these visits, is seeing while there are some of the food service workers who aren't masked, a substantial proportion of the people who are visiting our two major food service providers in Princeton are not masked. And that disappointed me. So we're going to try to figure out how to message that. This is part of the messaging tonight, but we're going to try to figure out how to message that over the coming days and figure out how to do that. I've probably gone on way too long myself, but the big message is to repeat, this is going to go on the rest of the year. We've got these 4 categories that we're going to try to stay, and we're going to try to protect and move back and forth with. This could be a common language between us. You could say, gee, where are we? When a cluster comes up, we're going to try to surround that cluster and do everything we can so it doesn't break out and there's a minimum amount of damage around that cluster. We're worried about these vulnerable populations, and the community still has a way to go in terms of masking. I myself, I go outside. The vast majority of bicyclists do not wear masks. I talked to And, you know, I've been struggling with how to message that to my friends right around the Littlebrook session that I'm in. One of my neighbors said to me just about an hour and a half ago, he said, you know, I'll be driving on my bike. The reason he was wearing a mask. I said, why are you wearing a mask? I'm interested. I'm glad you're doing it. He said, I'll be driving my bike. Someone will be in front of me. I will essentially honk at them. They will not move out of the way. And then very rapidly, admittedly for a brief period of time, we're substantially less than 6 feet apart. So bicyclists, I know, feel this way. Oh, I'll never be exposed to anybody. I'll never, that's great, I guess, except it doesn't seem to be working where people are not, they're getting within 6 feet. Is it a big deal? I don't think Jeff and I have the data to say whether it's a big deal or not. It's an unusual message. If you feel like you don't have to protect the person in front of you, you're not wearing a mask, you're basically telling that person, I don't need to protect you. Because that's what these masks, these cotton masks, cloth masks are all about. You protecting the other person. They're sort of helpful with protecting you. But if you're both wearing a mask, that's where the protection gets expanded. I'll stop my my presentation there, and I don't, Jeff may have a reaction, or obviously back to you, Liz, for council questions.
Yeah, I know we have a question from Ms. Niedergang, so we'll start with you.
Thank you very much, Jeff and George. You guys are my heroes. I cannot imagine having two better qualified, reliable, calm messengers for this situation. And as I think the mayor already said, I'm grateful for it every day. So thank you. I have 4 questions and a comment. The comment being that in the last executive order issued by Governor Murphy, municipalities were specifically forbidden from going beyond what the state government had done. So for example, I do not think we would have the authority, even if we all wanted to say, for example, you cannot go into a restaurant or a place of business without a mask. I think that is accurate. I think there were a lot of municipalities that were pushing the state to do more. And I think essentially now we've been hamstrung on our ability to do anything in addition. So I'll try to, the questions are fairly brief, and I'll start with one to Jeff, and then if you don't mind, I'll go back for the others. So Jeff, our health officer, do you have the staff you need for what's going on now, and what, if anything, can we do to provide you with tools that you need, whether it's staff or, I just want to make sure you have what you need to do this very important job.
I appreciate that. Leading up to this pandemic, we were on the track to hire a full-time nurse. It's been something that, we've been talking about with the Board of Health for a while. You've heard those discussions too. What a full-time nurse provides is somebody there pretty much like I am in terms of, receiving information just for Princeton. Right now we share our nurse with another municipality. And when that's the case, the person gets pulled in both directions for different disease investigations. So it can be kind of difficult. So, we really need to focus on trying to get a full-time nurse in the future. That would be dramatically helpful. We're very fortunate that the town actually acquired a new REHS who actually had significant disease investigation experience. So he's been assisting me from an operational level with data, trying to get it out to the county and then onto the state, because we've been doing such extensive contact tracing. These conversations, you might pick up the phone thinking you're trying to get a piece of information. It might take you 5 minutes, and you run into an hour-long conversation about other people they might have had contact with, and you're essentially trying to suppress a disease fire. And so from that capacity, this is a pandemic. It's definitely unprecedented in terms of workforce. but Princeton, based upon its population that travels and its ability to have very unique circumstances in public health, Princeton needs a public health nurse full time. Outside of that, what do we need? I think we need to start allocating emergency funds through OEM for public health. And I think Chief Sutter will probably allude to that and get to that as well. But I think that's something we just need to keep on the forefront. The strategic national stockpile that we heard of that was not able to fulfill some of the N95 things, we can do some of that more on a local level. I think we just need to pay attention to it more.
Okay, thank you. And so then my questions, just to reiterate, I think a brief conversation we were having at the beginning, the recommendation is that people should wear a mask whenever they leave the house, even if they're walking someplace where there's not very much other traffic. Is that accurate?
Anytime anybody's going to go into the public, I mean, if you're walking down the street, there's a likelihood you could be coming in contact with the public. If you're driving in the car by yourself, I wouldn't necessarily consider that public unless, you know, somebody might come to your window and you're going to expect that. But if you're going to go into the community and walk around in the neighborhood, I think you at the very least better have it on or have it with you, because you might come into contact with somebody at some point. You just don't know.
Okay, great. Today I was taking a walk in my neighborhood without a mask, which I will correct for tomorrow. And I passed by a truck with two people from a local pest control agency who were standing probably within a couple of feet of each other. One of them was clearly younger and receiving instruction, and the other was, you know, I from what I can tell, a supervisor. I walked by them and then I circled around and I came back and I said, you know, you're really not using appropriate social distancing. There's new evidence that normal conversation can spread the droplets to people. Then my family yelled at me for doing that. So I want to know both what we as individuals should do when we see this. And I was thinking maybe I'd call the company on my own just to make sure they're sending the right message. But what would you recommend that we as individuals do? And that goes to other members of the public. And what is there, should we report this in some way to the health officer? And Jeff, I don't know if we
Jeff got
lost you.
kicked. Jeff got kicked off. He's trying to get back on.
Okay, so maybe George, you could.
Yeah, I came upon a group of construction workers yesterday on Sunday, about half a dozen construction workers doing heavy lifting, panting, breathing heavily, all within a foot or two of each other. It's not, I mean, it may sound funny. It's not meant to be funny. I get the same pushback from my family when I intervene. I think, and for the participants that are online, I would say, I think we are in a situation where you attempt to do gentle social questioning. These can lead, unfortunately, to harsh words between people. So we don't want to encourage people in getting into confrontations. But the first comment might be a reminder. Oh, gee, you appear to have forgotten to do this or something like that. But in terms of calling the health officer, I think we can see the communities to the north and to the east of us have taken a much more aggressive stance on even small numbers of people congregating without proper masking. And I think a question for the council and for the OEM group tomorrow, the emergency management group, is, if and when this escalation occurs of, there's 15 people doing this, or even in some parts of North Jersey, it's 5 people doing something. Fred Williams, who used to work with the police department, some of you may remember, Fred has also contacts in North Jersey. He said that there are police officers that cruise some of the cities in North Jersey, and if they see any groups of people, 2 or 3 vehicles will come and break up the group. That's not, my hometown of Patterson is not Princeton. I get it, but depending on how serious things get, I see it as much for protecting these workers and attempting to empower these workers. So a call to Jeff, and if it takes it, a call to state OSHA, PIASH, or to federal OSHA. Now they're inundated, but I sent an email around to Jeff just before this meeting of 3 grocery store workers who have died across the United States. So we have to take that very seriously. So I'm sorry, Eve, I went on too long.
No, thank you. I'm gonna skip the final question in the interest of time. It's really something looking into the future. So thank you again. I'll turn the microphone back to someone else.
Councilwoman Fraga?
Yes, thank you. And I also want to comment on the great work that Jeff and George are doing. I think I'm getting to know them much better during this crisis. I'm liaison to the Board of Health, and I'm very impressed with the regular briefings that we're getting. They're very helpful. And I know that in those briefings, I've expressed my concern for, you mentioned our vulnerable population, and just comment that this vulnerable population, while we're providing guidance about social distancing and wearing masks and all that, some of them is not by choice. So I'm very concerned about our population who are living in crowded conditions, who don't have access to healthcare. And so if someone were to get sick, we're looking at probably a very serious situation there if that happens in that community. When you were talking about the essential workers, that some of them are right now by necessity, or they're being required to working without proper protection. Some of them, from what I understand, it's not being provided by their boss, their job. So they're expected to provide it themselves. And so I've seen workers that try to put a bandana on, but what I see happening is that as they keep trying to adjust it, they're touching their face. And so I even came across, when you mentioned coming across someone and whether it's appropriate to question them or provide some guidance, I think, it really have to be sensitive about that, because I did come across someone who, to me, it sounded like they were scolding someone, a worker, because they weren't wearing protection, and making it, make it sound like it was their fault. And first of all, I wasn't sure whether there was a language barrier there too, because the person that she was scolding looked like they were very concerned and worried about what they were being told. So I don't know if there's anything that we, as the municipality, can do as far as providing whether it's proper protection for those that are still working. Or though I should mention that there are some groups, interested groups in the community that are also expressing concern for a vulnerable population, and are discussing ways in how they might be able to organize to provide assistance. Not just I know there's many funds that have been established to provide assistance, but extra support, especially for a population that may not have, even if they're eligible for the assistance, they may be too intimidated to apply for it.
Letitia, a couple things. Today we identified the guidance from the New Jersey landscape construction industry, which actually it pretty clearly lays out the use of personal protective equipment of some sort if people are going to be closer than 6 feet. There is a registration process for landscapers in Princeton. And so we found both that material from the New Jersey Extension Service, which is run by Rutgers, in both Spanish and English. So we're going to attempt to do this to a certain extent from the top down, i.e. talking to the registered, or sending messages out to the registered landscape businesses. That's the hopeful way of doing it, is that they will do the right thing for their workers. But we also understand that this could cost them money, and they may be different landscaping organizations may be faster and slower. I would point out that the citizens of Princeton that purchase landscaping materials, we always bring this up about purchasing tree removal, that you have to be worried about the worker safety when you purchase tree removal. And frankly, safe tree removal is more expensive than tree removal that isn't safe.
Right.
Bluntly. So some of the people who are purchasing landscape services, I believe, have a certain responsibility to, as the purchaser, to speak with the person who's providing their landscape services and say, I want the people on my property to be safe.
Yeah, but more, I just wanted to mention that more importantly than the landscapers, it's important for them to wear proper protection as well. But I think more importantly, I understand that there are food service providers, those who are preparing food for takeout many are not wearing protective.
Well, Letitia, where I was going to go with that, and I was thinking of what Councilperson Perron-Lambros talked about, and that's the business conversation. I believe you said that was on Thursday. That might be a venue for either myself or Mr. Grosser to express the need to protect the workers. I don't know. I'm certainly willing and able and available to do that.
Yeah, I'm hearing from the workers themselves that they don't have. They're certainly not getting it from their employer.
Well, that's why I was interested in talking to the owners.
Yeah, thank you.
It looks like Jeff is back.
That's great.
Actually, Jeff,
Michelle.
Sorry, can I add something, Jeff? Now that you're on, could you say something about? Because I know it's something that we had also covered, where if someone's feeling ill and they don't have they don't have a doctor, because I know there's a testing facility, but one requires a prescription or be from a doctor to be able to get testing. Can you share what individuals in those situations, what they can do?
Sure. Thanks for bringing that up. So the prescription testing, that was through the Mercer County testing site at Quaker Bridge. There's a number of other opportunities for people to get tested. The community testing site that New Jersey Department of Health, along with FEMA, that have set up, you do not need a prescription there. You just need to be experiencing the symptoms that we've been hearing about, dry cough, fever, shortness of breath. Those individuals can go to those testing sites. Those are listed on our website, on the COVID website, www.princetoncovid.org. I know those community sites have been in high demand, and people have been, turned away from there just due to the sheer numbers that are going up that way. If they're interested in more localized testing, there's a few things they can do. There's a number of different telemedicine opportunities right now, some through RWJ, and then another one through Hackensack Meridian, where they actually can, I believe it's for $10 or $15. But if you're over the age of 65, it's free. If you go on to either RWJ website or onto, and I'll put all these on the website, and there's also testing resources on there, and we're updating those daily. But it's as simple as they can find the link on the website. They'll get a time slot, they'll talk to a doctor, and then the doctor will let them know if they fit the criteria for testing.
Okay, thank you.
You're welcome.
Thank you. And thank you, George and Jeff, for all of your great service. It's really, it's heartwarming to see how much people have just come together in the community to help. To the point about the conference call on Thursday, I think you're invited already to be on that.
Okay.
I'd love for you to talk about the mask. You might not know it yet, but you're invited, and we've already put you on the agenda, I think. So I think talking about the masks would be great. I think there's confusion, though. I just wanted to mention this because first, this really just came out a few days ago from the CDC that, it was really important to do the homemade masks, but there's been a hesitation. I know personally hesitation because we don't want people to take away the N95 masks from the health workers, the front lines that really need to have that additional protection. And there's been confusion whether or not the homemade masks are helpful or not helpful. And now we're saying it is helpful. And we would like food service workers and retail, so on and so forth, to be wearing them. And today is the first time really I've heard about being outside and needing to wear one, because when I walk my dogs, I haven't been doing that, but tomorrow I'll start that as well. What could be helpful for us as well is if we could put out any guidelines or any ideas. I know there's various websites and a lot of well-wishers and people that want to help, but really knowing how do we make masks, or are there other places we can get masks that aren't taking away the healthcare workers' masks, but are acceptable and helpful. So maybe if we can think about putting something like that out right away.
Well, I've been working with various groups in both the county and the town. I'm not sure any of them are ready to announce, but there are projects that are in the development stage to that are akin to the Million Mask Project is one that came out. There are many. There's in fact an overwhelming number of designs, which is actually kind of a challenge at the moment. There's also something called the Mercer Mask Project, and masks. Maybe I can spend a minute. Masks there are three possible things that you can do with a mask. Or three types of masks. The N95s protect the healthcare worker. And they're really, when you're in the throes of dealing with a patient especially a patient that is symptomatic, these are also used for some of our first responders, not all the time, but when they're transporting someone that they don't know, may or may not be infected. Both police and PFARS winds up being in situations, the Princeton First Aid and Rescue Squad, as well as the fire department, wind up being in situations where they're with people, they don't really know what their circumstance is. The second one are these surgical or procedural masks. They provide, if you will, hallway protection in hospitals where you're walking down the hallway and you're not necessarily doing a procedure, you're not working with the patient where you might be inducing a really explosive cough or something like that. And then the third type are these community masks. And the value of the community mask is when both people wear one,
Right.
there's some protection for both people.
Okay.
There's not a lot of protection. They're not great. They're an expression of how dire the situation is.
Okay.
And now there are plenty of documents online that talk about various escalating levels of attempting to get closer to I use my hands differently, the N95 level. And there's a lot of different ways. Some people are buying different materials, vacuum cleaner bags, HVAC, filter bags, all these different. We're not, with a community mask, we're not trying to create an N95.
Okay.
It's great if you can do that, but we're trying to create some modest protection. And if both people wear it, and Michelle, that's why we're saying to encourage people, maybe if you got it around your neck and then you put it back up when you see somebody coming, something like that, you're both trying to protect each other. That's where we're going with the idea of protecting people at work sites. We don't have enough surgical masks, let alone N95s, for every food service worker to wear a surgical mask.
Right.
Even though some of the masks I saw at some of the places that I toured this weekend were in fact surgical masks. I was tempted to talk to management about exactly where they got them. I decided to draw the line on that one. So Jeff, you may have some comments on the masking issue also.
No, I'm just go back to the fact that asymptomatic individuals that might be carriers of COVID-19, it does give us some risk decrease there, which again, we're looking for anything we can get at this point to assist with that.
Okay, good. Thank you. Thank you. I think that's very helpful.
Me? Okay, thanks. No, I just wanted to comment on the mask. I think some of my colleagues already are aware that I've been busy sewing some face masks, and I found some really good patterns that are easy to make that include filters, like you mentioned, George. But I'm working with some members of our community who are interested in making them available to, not the ones that I'm sewing, because there's no way that I would keep up, provide as much as I would like to provide them to everyone in our member of our vulnerable population. But what we're working on is I'm putting together a no-sew pattern that would also include a filter. And I'm going to be recording a short video, instructional video in Spanish that we're then going to share with the community, provide the materials that they need, and also, and then through WhatsApp or social media, share an instructional video on how to put it together. That's it.
Great, thank you. Council President Cohen, do you have some questions?
Just a quick follow-up on the masks. George, you didn't discuss construction grade masks that you might get at a Home Depot, where those fall in the spectrum, or do you know?
Well, there are part of the reason I didn't is there are multiple types of masks at the depot that are, some are in fact N95 masks, and then others are a lot of different masks. So they're somewhere between the surgical mask and the, but some can be here too. Some can be between the surgical mask and the community mask. So there's such a multiplicity. Now, it would surprise me if I went to one of the big box stores and they actually had a lot of masks left on the shelves. Maybe they do, but that would actually surprise me if there were any out there to buy.
Okay. Thanks. Are there any other council comments? Eve, did you have a follow-up question? No, okay.
I
well,
do actually,
okay.
I forgot to lower my hand, but I do actually have, which is, this seems, and this is directed more to Councilwoman Fraga or to others in the community. It seems like this might be a nice way for people who have the skills to earn some income. You know, those of us who cannot even sew a button on might be willing to, buy a mask from somebody who is much more talented in that area. So I wonder if there's a way to, match those who have the skills with those who do not, but who would be willing to, to pay for a mask. So I don't know if that's been considered.
Well, we can poll members of our community, see if there's anybody that is willing to take that on.
Okay. All right. Well, I want to thank Jeff and George again for your report and for your work and in helping to get us through this. So thank you very much.
Mayor, can I throw in one little more tidbit? I've been working with the vice president of the vice chair of the Board of Health, Meredith Hodak Avalos. And when Eve asked the question whether Jeff had everything he needed, I feel compelled to say, everybody's got to stay healthy. So there is a continuity of operation plan here without spelling out, uncomfortable details. We all have to be thinking of if we're not well enough to do our jobs, who else is going to do our jobs? So I just bring that name up for the council Meredith Hodak-Avalos as, you know, if for whatever reason I can't do my job, I can't, you know, as chair, she's been in some of these early morning meetings. I think you'd find it a great pleasure to work with her. And I keep urging Jeff to take it easy.
And real quick, Mayor, just to throw in there, I know Kip Cherry had a good question about the mask information. We'll make sure all that's on the Princeton COVID website. And I appreciate everybody's support. You all have been, you know, sharing your own experiences locally, and it does help us with regards to seeing more around the community. So thank you all for your support. And George, thank you very much for everything you've been doing for us in the community.
Great. All right. Thank you. Okay, so the next report is COVID related, and I want to turn it over to Mark DeShield, Municipal Administrator, to talk about how the stay-at-home order is impacting municipal operations, and what the plans are currently and moving forward on that.
Thank you, Mayor. As part of our mitigation strategies to combat the COVID-19 crisis, we have reduced and trying to reduce the spread of the virus. The municipal offices have been closed since early March to the public. They will remain closed until further notice in our efforts to try to mitigate the virus. At this point, all essential municipal employees continue to provide their services to ensure the health, safety, and welfare of our community. We recognize one of the things that we early on recognize is that in order to continue to provide the service through the duration of this emergency, we needed to employ some new strategies to ensure that we didn't allow the virus to take out large portions of our departments. That being the case, consequently, early on, the police department employed the idea of splitting shifts. This allows us to isolate certain number of employees to work at times, thereby reducing the opportunity for the virus to affect large departments and really knocking us out from providing vital services. They began this process early on, and it's been very successful. This technique has been deployed throughout the organizations with the other departments just based on their organizational needs. We have fashioned that. In addition to that, other employees, where possible, are working remotely. In addition to working remotely, they're also providing services by doing combination of working remotely and coming into office for those services in which they need to come into the office. We've employed drop boxes that allow individuals to come in and drop things off that will allow us to process some applications. Residents, the easiest way to can still access service in a number of different ways, that including payment of their taxes. We have the ability to do that via online by going to the Princeton website. And if you go to the tax collectors page, there is an online service for paying your taxes. Again, you can still mail your taxes. Essential building permits and inspections continue to be provided. You can obtain those by emailing the construction office, emailing Jay Pednati at princetonnj.gov. You can go to the website and on the construction office page and find that email. As usual, any general inquiries to the municipality can be obtained by going to Access Princeton via the app or the phone number 609-924-4141. The best way to reach most departments is through email. Again, if you can go to the website in any department that you need, generally go to that page, and there is either a general email for you to go to or an individual email. The court offices have been suspended, and generally the operations throughout the organizations have changed to deal with the crisis and the stay-at-home order. This court continues to process, even though they're closed, they continue to process their essential duties, including warrants, temporary restraining orders, and this is done on a case-by-case basis. Corner House continues to provide counseling services. They have moved away from the in-person counseling unless absolutely necessary. they're doing counseling either telephonically or by virtual means of using things like the Zoom platform. The planning office continues to take in applications, particularly for those jobs that require building permits and doing the approvals necessary for building permits. We are working on, last Friday, we received guidance from the state in terms of doing virtual meetings for the planning board. The one thing that will happen, we're scheduling the first planning board meeting on April 16th. That will be for mostly administrative matters. There's still some work concerning actually holding hearings for those matters that will require testimony or things of that sort. The health department has been all hands in, and I do have to say, and I want to give credit to Jeff Grosser and his staff. They've been here and doing a superior job in really managing this thing. And my hat's off to Jeff and his team for the things that they have done. In addition to, I will also want to talk to Chief Sutter for all the work that he's done. In the engineering department, we continue to do work in a number of projects, including Bank Street, Linden, and most of these are coordinating activities, which include contractors for doing different jobs and doing necessary reviews in order to move construction permits forward. The recreation department continues to provide some maintenance services throughout our open spaces to ensure people have places to go and to kind of get some walking and some exercise. They continue to pick up garbage and things. In addition to that, they've played a critical role in supporting the Human Services Department and helping in the outreach efforts there in the that are being coordinated through our Human Services Department. Our Public Works Departments continue their essential services. They've also moved to a team process in which a certain number of employees are coming in. They continue to do things, including providing cleaning services since employees are still coming into the building. They're also providing brush and leaf collection because a lot of residents are still with some time on their hands or actually going out and doing yard work and to remove those, ensure that our roadways are safety and other essential maintenance tasks that are required to do. They're continuing to do that. The municipal staff continues. We meet every day. We continue to provide different ways in order to kind of provide services in this new and kind of changing world that we have today. So that's where we are, kind of an update on municipal operations.
Okay, thanks, Mark. Are there any council people who'd like to, Mr. Williamson, do you have a comment?
Yes, thanks, Mayor. Mark, one thing I wanted to mention was for the operations of the municipal court, one thing you may want to consider is, I'm not sure if you're familiar with it already, but it's a plea by affidavit. And essentially, we've used those for years where if we have, let's say, a defendant who lives far away, where they can enter a plea by just signing a certain form, knowing their rights, et cetera, and they can actually pay their fines remotely by credit card, et cetera. And what that would entail is maybe have the municipal prosecutor either call attorneys for defendants or call defendants if they're appearing pro se by themselves and see if they're willing to accept certain pleas. And that at least will keep some operations going, and you won't have such a backlog when things return to normal.
In fact, it's interesting you bring that up. Today, we were having discussions with the municipal prosecutor just on that subject about doing pleas. In addition, the municipal court is also looking at, they're working with the state in terms of doing more virtual court proceedings, anything that they can do at this point. They're working through that process of what are the actual rules will be.
All right, awesome.
Thank you. Mr. Cohen?
Yeah, I just wanted to follow up a little bit on some of the online capabilities for processing various kinds of permits, whether it be construction, land use applications, but also, and we talked about this some at the last IT meeting. I think, or maybe it was in follow-up, that GovPilot is actually offering about 10 free services that usually would be not free. And they're doing it to sort of help municipalities get back to operations during the COVID crisis. And I'm just curious whether we've been looking at those kinds of transitions, and if not, when we're going to start implementing some of that stuff where forms can be filled out online instead of printing out a PDF and filling it in by hand and scanning it and mailing it back, and so on.
Actually, thank you for the question. Actually, a number of departments, we've already started the process of identifying those areas where we can do forms online. A lot of those we'll be using. We already have the Seamless Doc application, in which we're putting a lot of those forms on our Seamless Doc platform that will allow us to put those applications online. So that is in process.
Okay. It would be great if we could get a report for council of the specific forms that are moving forward, and
Sure.
Where things don't seem to be possible, why, which things we won't be moving forward with.
Can do.
Yeah, Ms. Niedergang?
Thanks. I can't see my hand. I'm gonna lower my hand now. Just a quick follow-up. The planning board is not the only board or commission that looks at plans, let's say. I know PC is going to have the Princeton Environmental Commission will be meeting this month, and one of the things on their agenda is a review of a site plan, and Shade Tree also reviews sites plan. So how does that get handled? With the actual, because normally they have a document that gets passed from hand to hand, which is awkward enough under the best of times, and now seems really unwieldy, considering you'd want to sterilize everything. So it doesn't have to be answered now, but you can if you want, but some guidance for those two committees, Shade Tree and Environmental Commission. I don't know if any other committees are also reviewing site plans.
Historic preservation would be another.
Thank you, David.
One of the issues that we will be dealing with is providing guidance to each one of those groups in terms of some of those issues. For some of the committees, we will be able to use PDFs, and as in this platform, you can share some PDFs through the platform. There may be some other opportunities where we may need to try to find some alternatives, but we are looking at that, and we'll provide guidance to each one of the groups. Again, this is our first virtual meeting, is with Town Council. We're working on putting together county policies and some guidance for the rest of our committees and other groups in order to do virtual meetings.
Any other questions for Mr. DeShield on municipal operations? Okay, so we'll move on then. You didn't have a question, David, did you? A follow-up question? Okay, so we'll move on then to the budget impacts of the coronavirus update and a revised schedule for budget adoption. We do have a budget that was introduced prior to the outbreak, and even though the public hearing on that is not until the next meeting, we thought it was important to bring this to council because my sense is that there's, given that our world has now changed, that we might have different priorities in putting together the budget. So wanted to first have Mr. Shield report on what those impacts are, especially on the revenue side, and talk about the calendar, the revised calendar. And if people want to have a brief discussion about, what our priorities might be in bringing that budget back, we can discuss that after Mark's report.
Thank you, Mayor. And as you indicated, our lives have changed. And based on what has happened with the COVID crisis, our financial picture has also changed. In recognizing that, the finance staff took a look at our municipal budget as we have introduced it, particularly paying attention to the revenue sources. Based on the stay-at-home order, we know that there will be a number of revenue sources which we believe will be impacted by that. Those include municipal court fees, parking fees, and then some of our miscellaneous permit fees. Based on taking a look at what our current revenues that have come in and what we project for the future, we're going to make some recommendations to council on the 13th, some adjustments that will deal with what we expect in terms of revenue losses on the municipality. In addition to that, council may have some other priorities based on the changing situation that we can have some discussions about making other recommendations. We can talk about that at the end of my short presentation. Two, the state also recognizes the changes that have occurred based on this virus, and they've revised the budget schedule. Initially, the budget schedule required us to adopt the budget by April 30th. Based on what's going on, New Jersey has extended that budget deadline to May 30th. What I'm recommending to council is the following. Our public hearing was scheduled for the 13th. Because of our initial analysis of the revenue shortfalls that we expect, I'm requesting that council do an amendment at that meeting to amend to adjust for those projected revenue shortages that we may have. In addition, council may have some priorities on its own, make those adjustments to the budget. What that would mean is the budget we'd have to re-advertise the budget, and it would go to the meeting on the 27th for a public hearing and adoption. Between the meeting of the 13th and the 27th, I would also suggest we continue to look at the budget. Things are changing on a daily basis. And if there are any additional recommendations in terms of changes to the budgets, we can make amendments for the meeting of the 27th. So I'm looking forward to, one of the things I do want to talk about, there was some concerns initially about state aid. The state has said that the state aid will stay flat for this year. So we have no impact in terms of state aid reduction from the state of New Jersey on this year's budget. So I'm really looking for council's reaction in terms of any budget priorities as we put together some amendments for the 13th.
Let's start with David.
I actually, well, I'm going to suggest, following up on the theme of what we were just talking about with electronic processing, I'm going to suggest a budget increase, which is to plan for software expenditures to allow us to really embrace the online process. I know I mentioned the free services that are being offered by GovPilot, but there are others that I know won't be free. And I think we should be doing a little bit of research and ascertaining what the cost of that will be and planning for it, because we really want to move forward with that.
Councilwoman Perrin-Lambros.
Yeah, I have to agree with Council President Cohen on that. That is a priority. And another priority, what we talked about at the CFAC committee meeting this morning, is keeping, I would say that, I would put out there that we should keep it flat and have no even incremental small tax increase, but keep it flat as much as we can. So looking at where we can cut to keep that consistent to help, with the taxpayers. I know it's going to be a tough year. So I would throw that one priority out and really looking at the various capital improvements and seeing where we might be able to do some long-term changes. So those would be things I would look at in terms of priorities.
Mr. Williamson? You need to unmute.
Thank you, Mayor. Councilman Cohen's comments just reminded me of a question. I know the state has been dealing with issues of legacy software. And I'm just wondering if there's any issues we're facing at our municipality.
I'm assuming you're talking about software in which
Programming was done in languages that a lot of the newer programmers aren't using regularly now.
we don't have any of those issues at this point.
Okay, great.
Ms. Niedergang?
Thank you, Mayor. I'm wondering, in addition to obvious budget shortfalls, parking, administrative permits, ticketing, first I'd like to echo again, as I have for some time, what Council President Cohen, Councilwoman Perun Lambros said about electronic submission of plans. I think that has been a priority and definitely want to move that along. I also am, again, something that I assume has a high priority, and I don't know if we can do this at this point, but health officer Grosser's request for a full-time nurse, that may be an impossible hire at this point. I imagine everybody who has those skills is pretty occupied. I'm wondering if there are other, I can envision what the shortfalls are. I'm wondering if you could say something about where you see our expenses going up in ways that maybe I'm not able to conceptualize at this point. Like, where are we going to be spending more money than you anticipated a few months ago, if any, if you could just address that a little bit.
Absolutely. There may be some immediate expenditures for this disaster, but one thing I will say is we've already been declared a disaster area. We will be eligible for FEMA reimbursement for a lot of the initial expenses. The areas where I see the most would be the health department, and really the request from the health department in terms of the health nurse is really where I see the growth. All of these other ones, we're also going to see some decreases in some of our expenditures just based on where we are and things that we're not getting done. The real increase will be, I think, really investing in our health services area.
Ms. Sachs?
Yeah, I just want to fourth the support from David, from Councilman Cohen and Niedergang and Perun Lambros, that we not use budget cuts to in any way diminish our progress with submission of online forms electronically, and also with the GovPilot project, which if people who are watching aren't familiar with, you can look up GovPilot, and I think everyone would be really excited to see the functionality that it provides, and it's particularly timely given how much we're now being forced to do online. So I think this is exactly the push that we need to move forward with something that we've been talking about doing for a long time anyway. So I hope we continue to prioritize that. I also want to ask Mr. DeShield if we have asked all the department heads to submit a list, or do we have feedback from all the heads of the departments on what they think should be postponed or not continued with this year?
Absolutely. We've also asked the departments to look at their budgets, to look at what are the items that they don't expect to occur this year. They're looking hard at their capital. They've actually made some recommendations in terms of cuts for capital and some operating expenses. So we are in the process of doing that.
Ms. Fraga?
I just wanted to echo the comments that have been made by my colleagues, but also want to add that as we're making that list, and even with our department heads, getting feedback from them as what we want to recommend to move forward with and what to put off, but to really prioritize what's most important for our community, especially considering what we're going through at the moment. That's it.
Absolutely.
Okay. Thank you. So I think we heard a lot of consensus actually in this discussion tonight. So I think almost everybody would like to see at minimum a 0 increase budget, and also one that addresses the specific problems that we're seeing now in light of the COVID outbreak. So making sure we're positioned to do government virtually in a more robust way, and making sure that we have the resources in the budget to address some of the problems that we're going to be anticipating, especially on the health side and human services side. Hopefully that captures everything. And this conversation will be continued at our next 2 meetings this month. So we're meeting next Monday, April 13th, and then again, April 27th. Okay, if there's no final questions on the budget, we will move on to council reports. And I just, before we start with reports, I wanted to correct the email address for people who are listening by phone. The email address to submit a comment is Princeton Comments, and comments has an S at the end, it's plural, Princeton Comments @gmail.com. So that's if you have a question or comment that you'd like to submit and you're just listening by phone, you can submit it to that email address. Otherwise, if you're watching by computer, you can continue to use the Q&A function. Okay, so we're going to move on now to council reports, and we'll start with Council President Cohen.
Thank you, Mayor. I have 3 reports I want to give. One on the Neighborhood Buddy Initiative. I know people are aware I've been working on this. If there's anyone watching in the public who isn't familiar with it, this is an initiative that started actually a couple of years ago, working on pairing residents in neighborhoods to be of assistance to each other in the event of some kind of an emergency, really any kind of emergency, as a way to build our resilience as a community. And when the coronavirus started to hit seriously, Dr. DeFerdinando actually had reached out to me and asked how we could ramp up the Buddy Initiative to try to help with vulnerable residents in the community. So I've been working pretty hard on that over the last 3 or 4 weeks, trying to get the word out. Initially, it was mostly through electronic media, and we were getting a lot of volunteers through Nextdoor and other venues, people offering assistance, but hearing very little from people who were in need of support, and realized that we needed to reach out using what I call legacy communications, things that our older population is more likely to be comfortable with than social media. So first, working with newspapers, there was a full-page ad that the municipality took out about a week and a half ago in Town Topics, which covered a number of things that the community was offering, but among them the Buddy Initiative. And then there was an article this past week in Town Topics about it as well, so unpaid media. And we've been doing flyers that are being passed out both in individual neighborhoods by volunteers with some pre-existing neighborhood associations in town. And also were passed out at the affordable housing complexes that are managed by Princeton Community Housing. So we've started to get a more robust response. So far, we've had about 15 seeking support, about 65 offering support. And we have paired up everybody who's seeking support. So everybody who's looking for support has a buddy at this stage. But we still want to continue to do that outreach. So One of the things I've been thinking about is using the reverse 911 call system, and I wanted to get a little bit of feedback from council on that. Something that the police department has been reluctant to use for informational calls, but it feels like one of the most effective possible ways to reach populations who don't spend a lot of time online. If we could do a robocall and just give some very quick and basic information about the Buddy Initiative and how to learn more, how to sign up, I think that could really help reach the population in need. I have a list from people who have already signed up for Princeton Prepares, which is our database of residents seeking extra assistance, and am planning to reach out to that's about 50 names, planning to reach out to everybody who doesn't already have a local contact to give support, to see if they're interested in having one. So I think that's another sort of pre-selected group that could yield some additional people seeking assistance. But the last thing I want to mention is just that the original vision for this, and still the best way to proceed, is actually have people in neighborhoods who know their neighbors reach out to a neighbor. Just choose a neighbor who you know might be vulnerable and give them a friendly call and suggest, could I do an errand for you? You know, can I check in with you every couple of days and see how you're doing? Because for older folks, you know, the dangers of social isolation are as much of a risk factor, I guess, as being exposed to the virus. I mean, I guess it's not quite as deadly a result, but it's a problem. And having that kind of connection is really something that we're seeking in the town. And that's really the best way to do it. So again, as you're talking about the program, emphasize to people, you do not have to sign up. I don't need to boost my head count. What I want is to have people in town who could use some support, have that support. So that's the word I want to get out. The second report I want to give is on IT, and I've already made some reference to it, but I just wanted to go into a little bit more detail. There are a couple of categories of improvements that can be made to the way that the municipality operates virtually. One is, as we've already been talking about, online forms to allow people to access services without actually having to come in to risk exposure by going out in the public, but also it's protective of our employees where they're not having to deal with the kinds of challenges that Ms. Niedergang was referring to, where they've got paper plans, for instance, that have been touched by numerous people and have to be sanitized between every stop. If drawings are submitted electronically, they can be reviewed electronically, and that's what I was referring to when I mentioned the software that's needed. In order to be effective, review of online plans needs special software that allows you to check for changes between different versions of the drawing, or allows you to do measurements. And I know that the engineering department already has such software. I know they don't use it for all of their projects, and I know that the building department doesn't use that currently, but I think we should be moving in that direction. And then lastly is the question of the hearings. And again, Mr. DeShield referred to the work that we're doing in that regard. The attorneys are trying to get comfortable with the idea that some of these quasi-judicial proceedings, like the planning board, zoning board, Historic Preservation Commission, can happen virtually. There are different evidentiary rules that apply in those kinds of situations that they're concerned about. But because this guidance came out from the state late last week, that is basically explaining how to do it and how to do it right, I think that we have to also be concerned about the legal exposure we have if we don't put in place at least the opportunity to have this kind of meeting for virtual hearings on simple applications. Because otherwise we're going to be viewed, especially if other towns are already working on this, which they are, we're going to be viewed as sort of obstructionists, and we will be open to the penalty under law, which is that if an application is not heard in a timely fashion, and there are timelines that are required under state law for each different kind of application, if it's not heard in a timely fashion, it's deemed to be automatically approved. And so it's not like there's a risk if we do these hearings online, and there's no risk if we don't. I think there's a risk either way, and we have to balance those risks and start to offer at least some hearings for less controversial, less complicated projects online.
If I may, Mayor, David, didn't DCA put out some guidelines? I'm sorry, Mayor, something like that.
Yes.
David could mention that. I'm talking about the guidelines DCA put out.
Yes, those are the ones I was referring to. They put out detailed guidelines for how these hearings should be held virtually. The attorneys are saying that those guidelines don't have the force of law. They would have to be somehow given the imprimatur of the governor's executive action. So they're still concerned that there could be appeals of approvals that were given, even adhering to those guidelines very closely. I leave it to I'm not going to leave it to the lawyers to fight it out, because I think we'll end up with a too cautious resolution if we do that. I'm going to keep pushing so that our attorneys try to figure out a good compromise that allows us to move forward in an expeditious way without exposing ourselves to too much risk.
Thanks, David, for those reports. I would recommend on your first report about using the reverse 911 system that we have the communications committee consider that. I know the other recommendation that came out of the CFAC meeting this morning is that there's a very strong likelihood that the tax bills will be coming out later than normal this year because of delays at the state. And so we might want to do an additional mailing earlier with some information related to COVID, and the buddy system might be, a piece of that mailing. But again, I think like maybe the communications committee can take a look both specifically at your question and then putting together a larger policy about the use of the reverse 911. And I know there was also a question about Nixle that came up earlier. I think having some clear guidelines that we can all agree on, I think would be useful.
Yes,
So,
that would be terrific. Thank you.
and then I think with respect to the planning and zoning board meetings, my sense is that there's a consensus on council that we need to have these meetings in some shape or form. The guidance just came out on Friday, and this is a situation where Princeton's not unique. It's every town in New Jersey, and particularly every town in the country is figuring this out. So I think that we should probably put out some consensus guidance that we want to have these meetings, and we want to try to figure out how to get them up and running in the near term.
I agree. We can follow up
Okay.
offline afterwards and decide exactly what form that consensus guidance should take.
Okay.
So a resolution or something.
So Ms. Fraga?
Yes, thank you, Mayor. Mine, I just have one item, and it's actually a combination report and announcement, and that is on the 2020 census. In the past, I have talked about the work of the Princeton's Complete Count Committee and how we have been working on an initiative along with our community partners, collaborating on an initiative to ensure maximum participation. And we were discussing ways where we could ensure maximum participation by reaching out to the community, both at events and in some instances, we were hoping to be able to set up kiosks to assist individuals who needed help filling them out. Well, obviously due to our current situation, we can't do that. So what I want to reach out to the community and ask for their assistance to help us do the outreach virtually. First, by participating, by completing the census online, and also by helping us spread the word on the importance of participating in the census. I would like to point out that we during our current crisis, we are spending time apart, practicing social distance, but coming together as a community and supporting each other and caring for our community. And there's no better way to do that than to ensure that the funds that we may be eligible for, if more people participate, more individuals participate, that would help make us keep our community strong by being eligible for funds that would address the needs of whether it's in emergency situations, in being able to respond. My message is that I want to ask everyone in the community to help keep our community strong by participating in the census. And it only takes 10 minutes. I know all of you have already done it, hopefully, but just make sure that everybody in the household is counted, not just immediate members of the family. That's it.
Okay, thank you very much. Let's see. Next is Ms. Niedergang.
Thank you, Mayor. I just looked at the clock and saw how late it was, so I'm going to be really speedy. Princeton Environmental Commission is planning on meeting this month on the 22nd, probably with an 8 p.m. Start date after not meeting last month, and hopefully we'll iron out how they're going to look at these site plans. I just wanted to give an update on a little bit of what's going on in Public Works. We are still moving ahead with hiring for the position of Director of Infrastructure and Operations. We've done one round of interviews. There'll be second interviews this week. And we are still planning on moving ahead with some of our major goals, like looking at the waste stream and reconsidering that. We've been able to meet virtually and continue with that work. Councilwoman Perrone-Lambros and I have been working on segments of the Princeton COVID website that interpret state and federal assistance programs and trying to get that information out to the community. I've been a little bit delayed on getting the latest round of federal programs up. Those of you who are listening to this, I know that while officially the programs are open going forward, if you think that you might be eligible for some of the programs that the federal government is giving to small businesses, I would really urge you to get your application in as soon as possible, because even though there's no deadline, there's a limited pot of money. And so the sooner you get your application the more likely you are to have access to some of that money. And finally, about a week ago, I took the mayor's place on a call with our senators, Senator Booker and Senator Menendez. And most of the call focused, as was appropriate, on the current crisis. But I did seize the opportunity to ask a question about some environmental regulations coming down from the federal government that we're trying to roll back as the new auto standards that were just introduced have some of the gains in, the quality of our water and air. And I just want to reassure people that they are capable of working on multiple fronts. Both senators were very vehement about this is not, especially with a virus that affects the lungs primarily. This is not the time to step back on our enforcement of the Clean Air Act or to allow industries to pollute at will. So even though obviously most of our attention at the federal level is being taken up with this current pandemic, they are aware that there are other issues and will be working on those as well. And I encourage people to reach out to our senators or to Representative Watson Coleman if you need help processing any of the opportunities that are available from the federal government, or to just express your concerns with issues related to either coronavirus or anything else. And that's it. Thank you.
Thanks, Steve. Mr. Williamson?
Thanks, Mayor. Just a couple quick reports. From the Princeton Recreation Department, all municipal playgrounds, sandboxes, basketball courts, tennis courts, and platform tennis courts are closed until further notice. However, municipal parks and open space path, trails, and walkways remain open. The community is encouraged to maintain social distancing while using these public facilities. All group sports activities and programs are postponed until further notice. If you have any questions, please feel free to email the Recreation Department at recreation@princetonnj.gov. And just quickly on for Corner House, they've moved a lot of their services, their clinical services to telehealth conferencing, which is also HIPAA compliant. If you have any questions, feel free to call 609-924-8018 or visit their website at cornerhousenj.org. Something I think is important to mention also is the financial hit that Corner House and the Princeton Alcohol and Drug Alliance have been experiencing because of the pandemic. For example, Corner House is losing about $2,500 a week in billable hours because of the lack of having group type therapy. Also, on one last note on that, and of course, Corner House had to postpone both its main fundraising programs this year. And the last word on that is the Governor's Council that funds the Princeton Alcohol and Drug Alliance immediately suspended its $53,000 it would have given to Princeton Alcohol and Drug Alliance because it needed to reroute that money to the COVID-19 response. So they are exploring basically donations from private donors to assist with that shortfall. Thanks. That's it from me, Mayor.
Okay, thanks. And I also just wanted to give a shout out to the rec department for stepping up and being nimble and how they could help the community during this crisis. They've been helping with delivering food and stepping in where needed, and have been really just great team players. So I do want to give a shout out to rec for that.
Thanks, Mayor.
Yeah, Ms. Niedergang, do you have a comment?
Yes, I just, on Facebook today, I saw something from the rec department, and I'm just going to jump in here, Councilman Williamson, to ask you to be the conduit for this suggestion or comment. And the Facebook post was about membership in the community park pool, and that early bird membership ended on April 10th. So first, I wanted to make, of course, we don't know whether the pool is going to be open. Perhaps Health Officer Grosser might have a comment on that. But at this point, I'm hoping it will be open at least for part of the season. Maybe that's wishful thinking. But I'm wondering if it's possible to extend that period of discount on one hand. And on the other hand, I don't know, let's say you do buy a membership and the pool doesn't open. I assume people get their money back, but I'm not sure. So I wonder if that information could be conveyed so that people could act now and be assured that if the pool didn't open. And then I also had a thought, and maybe I know budgets are going to be tight, but I wonder if there's a lot of people are going to be taking a financial hit. And I know that there's discounts available for pool memberships, but I bet there'll be a lot of people needing it this year that maybe haven't needed it in the past, again, anticipating that the pool is open. And I'm wondering if we might be able to do, if it doesn't break the bank, a limited number of free passes to the pool for families or families meeting certain income criteria that maybe aren't entitled to the usual help that we provide, or just some kind of out of the box thinking. If this resource is open, how do we make sure that it's really available to the community?
Excellent points, Councilwoman Anita Gang. So these are issues I'll certainly take up with the Recreation Board.
Great, thank you. Ms. Pearl-Lambros?
Just briefly, I want to mention that the volunteer firefighters, there's a shortage right now because of the Princeton University students that usually volunteer are not there now. We have a few that we're going to introduce tonight and a couple more coming down the pike. But I just want to say that we are working together to get the word out and recruit more volunteer firefighters. So that's something that we need to do going forward. So I just wanted to mention that. But otherwise, it's going well with the new paid firefighters. That's it. Thank you, Nina.
Great, thank you. And Ms. Sachs?
No reports tonight, thank you.
Okay. And are there any staff reports?
None from me, Mayor.
Not for me either, Mayor.
All right, I think you guys have already given them.
You guys have heard from me enough.
Yeah, and let's see, Ms. Stockton, I know you're up with correspondence. Do you have any additional reports besides the Alexander project?
No other reports.
All right, so with that, we move on to correspondence, and hopefully people read those letters, but I did want to invite Ms. Stockton. If you want, you can have a CU, so you're not just like a voice from the Black Void. If not, you can just do it from without your video. But if you can just give us a report on the timing now of the Alexander Street Bridge project, and where we are with it.
Sure. Contained in the agenda packet are two emails that I've received with status updates on the Alexander Street projects. The first email is from the Mercer County engineer regarding their project, which replaces two structures on Alexander. The second email is from the New Jersey Department of Transportation regarding their project replacing the DNR Canal Bridge. Both agencies and contractors have made tremendous progress in completing their work under the very aggressive schedule that has been set for the projects. Unfortunately, on April 1st, and it wasn't an April Fool's joke, I did receive both of these notifications from the agencies indicating that it's likely that Alexander will not open until the end of April, weather permitting. They've done a lot of work to move the projects ahead. Unfortunately, they had some delay with some of the underground utility work.
Okay, thanks, Deanna. Are there any questions anybody has? Let's see, Ms. Niedergang and Mr. Williamson. Or do you guys still have your hand up from before?
I had my hand up from before, but I'll just jump in and say that, you know, kudos to the state and the county. This is truly amazing that under these really, really difficult conditions, that they will be a mere 10 days behind. So please, Ms. Stockton, please relay our appreciation for their hard work under difficult circumstances. I know we're used to kind of criticizing and you know, and so it's not, I really think this is an amazing achievement, and I hope it's being done with worker safety in mind. So thank you, and sorry about the hand.
Thank you.
All right. Thanks, Sienna.
Mhm.
Okay, so now we're going to move on to our ordinance public hearing for tonight. This is ordinance 2020-12, Princeton calendar year 2020 ordinance to exceed the municipal budget appropriation limits and to establish a cap bank, NJSA 40A 4-45.14. And despite the sort of frightening sounding title of this ordinance, it is something that is a routine ordinance that comes before council every year. It does not mean that we are going to exceed the budget appropriation limits, but it puts in place a structure that protects the municipality this year and moving forward. I don't know, Mr. Shield, if you wanted to give any further explanation to it.
Yes, Mayor, and I think you got it correctly. It's basically allows us to what they call bank the cap, the amount that we don't spend above the cap for the future. And what that allows us, if ever we're in a situation where we needed to exceed the cap, we would have a bank of dollars. It's almost an accounting type things that we could use to do that. So we bank it each year. We have not used it, but we bank it just because we don't know what the future will bring for us.
Okay, thank you. I don't know if there are any questions from council before we open up the public hearing. Doesn't look like there are any. So I'd like to open up the public hearing on this ordinance. If you have a comment, you can put it in the Q&A section at the bottom of your page, or if you're listening by phone, you can submit a comment by email, and the address again is Princeton Comments with an S at the end, princetoncomments@gmail.com. And we'll give it a minute just to see if anybody has anything that they're writing. And I don't see anything coming in, so I'm going to close the public hearing and bring it back to council and see if there's a motion to approve.
So
All right, so moved by Mr. Cohen, seconded by Ms. Sachs. Madam Clerk, can you please call the roll?
Ms. Perron Lambros,
Yes.
Ms. Niedergang,
Yes.
Mr. Cohen,
yes,
Ms. Fraga,
Yes,
Mr. Williamson, Ms. Sachs.
Yes.
So the ordinance was approved unanimously. And now we go to resolutions. The first resolution is 2137, resolution authorizing a professional services agreement in the not to exceed amount of $53,742.23 with GTS Consultants for the survey of Pretty Brook Road and Nassau Street North Side sidewalk. Is there a motion to approve?
I'll
So
move.
moved. I'll second.
Okay, so moved by Ms. Fraga, seconded by Ms. Niedergang. Any discussion? All in favor?
aye,
Aye.
Any opposed? Resolution passes unanimously. Next is 2138, resolution authorizing a bid award to Traffic Lines Incorporated of Farmingdale, New Jersey in the not to exceed amount of $71,845.80 for traffic striping and pavement markings contract. Is there a motion to approve?
so moved.
Moved by Mr. Cohen,
Second.
seconded. Who was that?
Ms. Sachs.
Ms. Sachs? Any discussion? All in favor?
Aye.
Any opposed? Resolution passes unanimously. Next is 2139. Resolution authorizing a professional services agreement in the not to exceed amount of $33,500 with Control Point Associates Incorporated for the survey of Mount Lucas Road. Is there a motion to approve?
So moved.
Moved by Ms. Niedergang and
Second.
seconded by Ms. Sachs.
Can I add a quick comment? I just want to commend our municipal engineer for breaking down these various surveys into separate contracts so we can involve different survey firms who were not able to do it when we presented it as one whole batch of 15 or 20 different roads. And I love that we're getting out some of these, the firms that are bidding and have succeeded in winning are minority owned. And I think that's really great. So I just want to commend her for her work on that.
Thank you.
Excellent. Thank you. Next is 2140, resolution approving the agreement to Custom Care Services Incorporated for mowing services. Mowing services A, not to exceed $29,924.10.
You actually vote on 139? I know it was moved in second.
Oh, right, thank you.
Oh,
All in
sorry,
favor?
I jumped in with my comment, but we didn't.
Yeah,
vote on
no,
it.
thanks, Mr. Williamson. All in favor of 2139?
Aye.
Any opposed? All right, that passes unanimously. Then we come to 2140, which is the resolution for the agreement with Custom Care Services for mowing services A, not to exceed $29,924.10. Is there a motion to approve?
So moved.
Moved by Mr. Cohen. Is there a second? Seconded by Ms. Fraga. Any discussion on this one? All in favor?
Aye.
Any opposed? Resolution passes unanimously. Next is 2141, resolution approving the agreement to Custom Care Services Incorporated for mowing services B, not to exceed $30,166.50. Is there a motion to approve?
So moved.
Moved by Mr. Cohen. Is there a second?
Second.
Seconded by Ms. Niedergang. Any discussion? All in favor?
Aye.
Any opposed? Resolution passes unanimously. Next is 2142, resolution approving agreement with U.S. Athletic Fields Incorporated for turf management services not to exceed $16,957.50. Is there a motion to approve? Moved by Mr. Williamson.
Second.
Seconded by Ms. Pearl Lambros. Any discussion? All in favor?
Aye.
Aye.
Any opposed? All right, resolution passes unanimously. Next is 2143. Resolution authorizing the award of a contract to Sunset Creations for the Princeton Spring 2020 ash replacement project in the amount of $26,220. Is there a motion to approve?
So moved.
Moved by Ms. Pearl Lambros. Is there a second? Seconded by Ms. Niedergang. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Resolution passes unanimously. Next is 2144, resolution authorizing the award of a contract to Sunset Creations for the Princeton Spring 2020 planting project in the amount of $31,165. Is there a motion to approve?
So moved.
Moved by Ms.
Second.
Pearl Lambros and seconded by Ms. Niedergang. Any discussion? All in favor?
Aye.
Any opposed? Resolution passes unanimously. Next is resolution 2145, resolution authorizing to retain Leckington Advisors LLC for preparing CDBG applications in the amount not to exceed $22,500. Is there a motion?
Can I just ask that you explain what CDBG is? Thank you.
Yeah, so CDBG is Community Development Based Grants or Block Grants, sorry, it's Community Development Block Grants. And this is something that Princeton has recently become eligible for again, and it's a significant amount of funding, but the application is also significant. So it helps to have somebody to help do that work, to prepare it. And Mr. DeShield, when would we expect to see the grant money come in? Is that something that's going to come in 2020 or not till 2021?
It will actually come in, the grant year will begin in October of 2020, but the applications are due in July of 2020.
Okay.
In addition to the entitlement we have for CDBG, we are also awarded some additional monies through the CARE program, the CARES Act, for the COVID relief funds. So in addition to that, they'll be preparing the application to expend those funds. And that's about 140,000 for the additional funds.
Okay.
And so it's not a question of you can get it or not get it, but the grant would be given. It's the money's available there. We just need to hire someone to do the application process for us.
That is correct. It's an entitlement grant, and it's a matter of you have to put together the 5-year plan and the application.
Great.
And Mark, can I ask, is that the individual that we spoke with during one of our teleconference? Okay, I was impressed. So I would like to move it if we're ready to.
Excellent. Is there a second?
I'll second it.
So moved by Ms. Fraga, seconded by Mr. Williamson. Any further discussion? All in favor?
Aye.
Any opposed? All right, the resolution passes unanimously. And now we can come to the consent agenda, which contains items of a routine nature passed by single vote. I would like to remove one item from the consent agenda, which is the last item, 2153. So we can pull it out for some discussion. Are there any other items anybody would like removed from the consent agenda? All right, is there a motion to approve the consent agenda minus item 8?
So moved.
Moved by
Mayor,
Ms.
can I just say, I guess it doesn't matter. I got an email today from the Princeton Festival saying they were canceling. I don't know if that matters. That's number 7. I mean, we
I
can
think
still,
that given it's in front of us, I think we should just leave it there.
Sure.
And then it's just, it's not like they're obligated to put it up.
okay.
So, all right, so the consent agenda has been moved by Mr. Cohen. Is there a second?
Second.
Seconded by Ms. Fraga. All in favor?
Aye.
Any opposed? All right, the consent agenda passes. And then I just wanted to have a short discussion about the last item there, 2153, which is a resolution of Mayor and Council of Princeton to establish a dedicated trust by rider, donations, acceptance of bequests and gifts for COVID-19 trust pursuant to NJSA 40A 5-29. This would enable the municipality to receive donations that members of the community and maybe different philanthropic organizations might want to contribute. I will say that during this crisis, it's every hour is like a day and every day is like a week. So things are moving very, very quickly. Sandy Webb put this together this afternoon and we were able to get it onto the agenda, and there has not been a whole lot of discussion about it on council, I understand. And there's still a lot of questions about how something like this would be governed. And so I think what might make more sense is, even though it'll mean a delay in terms of being able to receive funds, I want to make sure that we're very transparent about how this is going to operate and that everybody's really comfortable with it. Good news is we're meeting in a week. So I can send around and, people who are listening can take a look. I think a really great model is what they've done in Boston. And they have something called the Boston Resiliency Fund. And it's managed by a very, very small group. There's only 3 people on the governing board. And so that allows them to be nimble. And the way the fund is structured is there's some initial priorities and then some flexibility built into the fund based on, this is a very quickly evolving situation. And so it allows for those priorities to potentially evolve as the needs change as time goes on. So I will send that around so people can take a look at it. I do think it's, we have some calls into Boston just to see how it's working. It looks great on paper, but you know, to see what their experience has been like over the last week or two since it's been up, and to come back with something that's a little more formal next week with a structure. But you know, we do have to move really, really quickly. There's philanthropic dollars out there, and there's people who have immediate needs.
Right.
So I'd like to really try to prioritize this so we're not losing on some potential opportunity.
Okay.
Ms. Niedergang?
Thank you, and thank you. I was one of those pushing to delay this because I really am absolutely in favor of having some kind of centralized group that can collect and provide money to the community. But I'm also very concerned about who would be making those decisions. Who would be, if we had a team of 3 people, I'd like to know before I voted to approve this, who those people would be and what the guidelines would be for making sure that, that there is transparency and that absolutely the decisions are made with the best interests of the community as a whole. So I really appreciate delaying this, and I'd like to definitely see some more information on how this would be structured, how it would work during the course of the next week, and hopefully we can move forward on it.
Yeah, and the one piece of information I wish I had that I don't is, this is enabling legislation. It doesn't mean that we're going to set anything up. And obviously we can't have a governing structure without it getting approved by council. So my only concern in delaying is that it might put us off even more, because I'm not sure if this also has to go up through DCA for approval before we can start on it. So, like I said, it's like, it feels like every hour is a day, every day is a week. And so if this is enabling legislation, it might put this off. So even if we're ready to go next Monday, if we haven't passed this today, it might mean a delay. But I also understand people's hesitation, and I don't know the answer to that specifically. So I think just for everyone's comfort, what you articulated, Ms. Niedergang, it's like everybody couldn't agree. I mean, I'm sure you speak for everybody. It's like, we want this to be something where people feel comfortable giving. And in order for people to feel comfortable giving, they have to know what they're giving for. They have to have all those things articulated. So again, this wasn't necessarily the legislation to like put something up on the website and start collecting money. It was to create the structure to start that happening. Yeah, Ms. Sachs?
I understand what you're saying, but I just think as a matter of principle, I'm uncomfortable with voting on something where there's been no discussion. I just happened to notice that it was on the consent agenda. We hadn't even heard about it. We don't know anything about it. And
I totally agree. Yeah, I totally agree. That's why I'm pulling it off.
All right.
So, and the proposal is to bring it back on Monday, and to try to have a little more structure around it.
Great.
Okay.
Okay.
Or a lot more structure around it.
Okay.
We have a month because it's a week. So.
Right. So,
Thank you, Mayor.
All right. All
Very
right.
good.
And with that, is there a motion to adjourn?
I'll move.
So moved.
Okay,
Second.
so I will say that it's moved by Ms. Fraga, seconded by Ms. Niedergang. All in favor of adjourning?
Aye.
Aye.
Any opposed? Okay, meeting is adjourned. Thanks, everybody.
Thank you to everyone.
Be
Very
safe.
well.
Bye.
Bye.
Bye.